This is the lecture for community. Nursing in the home was the first type of nursing to be established back in the 1700s and 1800s by Florence Nightingale, Lillian Ward, Mary Brewster, and in the 1900s by Mary Breckinridge. At that time, nurses went into the community and into the homes. We're now trending back to this type of nursing. So the healthcare delivery system has changed dramatically over the last 2 decades due to cost containment by Medicare and Medicaids with their DRGs, insurance agencies, and the consumer. We're going from inpatient care to outpatient care. Length of stay is decreasing for all types of patients. This is increasing the complexities of care required post-discharge. And as an example, a person with a CABG that used to stay for 5 to 6 days are now being discharged after 2 to 3 days if there were no complications. Nurses will practice in a more complex healthcare setting. Many nurses will need to meet the needs of the patient and family outside an acute care facility. Healthcare delivery has moved beyond primary healthcare and now encompasses secondary and tertiary care within the community. So some definitions. Community is a group of people who share something. So an example of that are nursing students, the women's shelter. They share the experiences of domestic abuse, and group communities. Definition of population is members that may not know each other but still be in the same vicinity. So an example is high school freshmen. How many of them smoke, play sports, have pregnancy. They may not know each other, but they're in a population. Definition of primary health care is prevention of the initial occurrence of disease and injury. So example of primary health is immunizations, family planning, well child care, visits, education, fluoride treatments, use of seatbelts, child care restraints, and yearly physicals. Secondary health care is early identification of disease or disability with prompt intervention to prevent or limit disability. Serious or complicated care that has historically been provided to patients in hospitals. Outpatient surgery now does heart caths with stents, hysterectomies, and appendectomies. There's chemotherapy and blood transfusions, and diagnostic testing like MRIs and angiography. And then tertiary health care is assistance. So it's after a disease or disability has already occurred to help further disease progress and to meet one's potential and maximize quality of life despite illness or injury. Management of complicated long-term health problems and chronic conditions. And it includes things like outpatient cardiac rehab, AFib clinics, CHF centers, home health for bed-bound patients, home care for vent patients, whether they're adults or children, hospice for the terminally ill, and then home health for CHF and telemonitoring. So let's compare hospital stay to community and home care. With the hospital, the population is all ages, but it's mainly older than 40. Reimbursement is private insurance, Medicare and Medicare, and self-pay. Cost is typically greater than $2,000 a day. Quality is fast-paced care, often rushed. It's aimed at getting the patient through the acute illness to be able to go home. There's often more mistakes. Statistics support that. And when people are sick or in an acute state, they have a hard time retaining any education that's taught. Example of that is a new diabetic. Your type of care in a hospital is acute and rehabilitative. And case management is discharge planners, case manager in some organizations, clinical nurse specialists in some, used for complex needs, the hospital to hospital. Now community and home care, the population is all ages equally, but more commonly older in home care. Reimbursement is Medicare and Medicaid again, and private insurance. The cost is about $150 for an RN visit. It is the least expensive. Quality, it's a slower space. There's more time for relationship development. The patient directs this with more decisions made by the patient and family as far as what they want. The type of care is usually rehab, chronic, or end-of-life cares. And case management is the home care nurse throughout the patient's experience, and they are the gatekeeper. So comparing community-based versus community health. Community-based is the same as home health. The definition is the application of the nursing process in caring for individuals and families in community settings. The application of the nursing process in caring for individuals, families, and groups where they live, work, or go to school, or as they move through the healthcare system. All levels of prevention, including primary, secondary, and tertiary, are emphasized, but its focus is more on secondary and tertiary levels. Community-based nursing focuses on the primary client, which is the individual and their family. The application of the nursing process in caring for individuals, families, and groups where they live, work, and as they move through the healthcare system. Focuses on secondary and tertiary levels, manage acute and chronic conditions, and examples are home health, nursing, outpatient and ambulatory settings, and occupational nursing. So then community health definition is a synthesis of nursing practice and public health practice applied to promoting and preserving the health of populations. Responsibility is to populations as a whole, but care is directed to the individuals, families, and groups contributing to health of the total of them. Often work for the county with the primary client as is the community. There's a comprehensive approach which includes the environment, and the examples of this is public health, school nursing, and occupational nursing. Community-based focus is when nurses are given a specific number of patients to care for during the day. Community health focus is public health nurses who are concerned with the entire population. An example of this is assessing pregnant teens in Marathon County. How can the county improve their nutritional needs during pregnancy? All right, and then let's talk about community health nursing. So other community health settings are school health programs, occupational health programs, parish nursing programs, summer camp programs, and childbirth education programs. Public health nurses work in schools, homes, clinics, jails, and shelters. They work with communities, the individuals and families that compose communities, and the systems that impact the health of those communities. There are different types like insurance community health nursing, policy development, health promotion, health protection, health balance, disease prevention, and social justice. So Healthy People is a set of goals and objectives with 10-year targets designed to guide national health promotion and disease prevention efforts to improve the health of all people in the United States. So make sure you view the video on determinant of health, health across the stages. Leading indicators with Healthy People 2020 are suicide with mental health, access to health care, clinical prevention services, fatal injuries, homicides, and domestic violence, infant and preterm deaths, obesity and nutrition with all ages, oral health, and ETOH with substance abuse. There are 10 leading causes of death by age group. Age 1 through 44 is unintentional injury. We need to stress the importance of safety education and awareness because of this. Ages 15 through 34 is homicide and suicide. There are 10 leading causes of non-fatal injuries treated in the ED. The number 1 is unintentional fall across the board. Nursing interventions that are frequently used in community practice are listed here, and I'll let you just read through those. This model integrates 3 distinct and equally important components: the population basis of all public health interventions. The 3 levels of public health practice are community, systems, and individual family. The 17 public health interventions include surveillance, outreach, case finding, case management, health teaching, consultation, coalition building, advocacy, policy development and enforcement, disease and health threat investigation, screening, referral and follow-up, delegated functions, counseling, collaboration, community organization, and social marketing. Each of the inner rings of the model are labeled population-based, indicating that all public health interventions are population-based. A population, again, is a collection of individuals who have one or more personal or environmental characteristics in common. Public health interventions are population-based if they focus on entire populations possessing similar health concerns or characteristics, if they are guided by an assessment of population health status that is determined through a community health assessment process, and if they consider the broad determinants of health. Public health interventions are population-based if they consider all levels of prevention, with a preference for primary prevention. Alright, so community-based nursing, this includes ambulatory care, home health care services, and long-term care. Some nursing roles are listed there. With direct care provider, it might include physical assessment and observation, lab draws, administering medications, dressing changes and wound care, IV therapy, tube feeding, pain management, ventilator management, parenteral home care, postpartum home care, apnea monitoring, psychiatric home care, and the list goes on and on. There's also education, being a counselor, being an advocate, being a manager, so management of the nurse's time with limited resources, other personnel, program organization, coordination, and management of the patient's care. And then there's also researcher. So role as a collaborator, the nurse in the role of collaborator participates in healthcare management decision making with individuals from various professions and works with the patient and their family or their caregivers to jointly determine the course of the care. They coordinate visits with the patient to avoid two professionals visiting at the same time and tiring the patient out. And they integrate services to provide maximum benefit to the patient. So an example is having physical therapists measure blood pressure when they're visiting to ambulate the patient. For reimbursement by Medicare, documentation of all services and care given must be meticulously completed. Coordination of referral with community resources requires the nurse to be knowledgeable about services offered by their agency and any other community resources. Communication is important with reporting all important assessment and evaluation findings. And the nurse must initiate and maintain a collegial, collaborative relationship with the healthcare providers working with this patient. Case management is necessary because healthcare is complex and patients need to be guided in making the correct decisions regarding their health options and help facilitate a quicker, smoother recovery. Home health nursing has direct patient care when it's given to the patient and their family. It includes assessments, wound care, bandage changes, medications, teaching. Also confirming with social worker regarding payment and speaking with the physician about care and educating. They spend much of their time teaching patients and families about self-care strategies. Home health care is a comprehensive health care whereby health services are provided to individuals and families in their places of residence for the purpose of promoting, maintaining, or restoring health, or maximizing the level of independence while minimizing the effects of disability and illness, including terminal illness. Healthcare should be comprehensive and designed to promote, maintain, or restore health with the objective to maximize independence. There's a broad spectrum of ages and clinical diagnosis, holistic and focused on individualized patient, integrating their family, health, caregivers, and environmental resources. It's provided to persons with acute care needs, long-term health conditions, permanent disabilities, or terminal illness. And in home health, the nurse continues to follow the steps of the nursing process. Medicare and Medicaid finance is about 70% of home health services. Eligibility for Medicare, people are age 65 and older, people with end-stage renal disease, and people that are deemed disabled. Also provides skilled care and They must be homebound. The definition is it takes a considerable and taxing effort for that person to leave their home. Must be homebound to qualify for home care services. And then they have to have a certification to participate. To be reimbursed by Medicare, home health agencies must be Medicare certified. So some considerations with home health care: the caregiver has to be evaluated as well. They may be showing signs and symptoms of stress, like lack of attention to grooming, weight loss, messy living environments, being irritable, easily emotional, abusive, or they may lack the person doing the activities that they usually enjoy. Planning is also a large consideration in home health nursing. So think about someone's home. Is it a germ-free and neat as a hospital room? Are there dogs or cats and their hair present? Are there spiders in the bathroom? Homes are not like the hospital setting. Anything you bring into the home must be clean. You must wash your hands frequently. You cannot bring germs into the home from another home. Everything must be protected so that you're not introducing germs or taking germs with you. And everything the nurse brings in must be protected against that environment as well. Some other considerations are safety. There certainly can be dogs involved. The largest concern by many visiting nurses are dogs in the home. They have to follow agency safety plans. They have to keep themselves safe and next to an exit. And they should not allow themselves to be cornered in a home. They have to leave if they instinctively can tell there's a danger. And they have to make sure that office staff knows where they're going and what their schedule is. All right, this could be a typical NCLEX question. So they want to know that you can prioritize patient care. So working in home health, you have been assigned 4 patients. Which patient would you see first and why? So you've got a 29-year-old male with fractured fibula that's casted. He has a window placed on his cast for wound care. He has complained of increased pain to the lower leg this last week, and the drainage yesterday was yellowish. You are suspecting infection. The second patient is 82-year-old male with dementia who requires a medication setup and has a history of mixing up his meds. You are managing his medications. The third patient is a 78-year-old male post-CEA. He states he has been occasionally seeing double and his blood pressure was high this morning. And the fourth patient is a 25-year-old woman with preeclampsia in her 35th week of gestation who requires a urine sample, blood pressure, and assessment of edema. So, your pre-visit planning involves determining which patients are to be seen during the day and prioritization of the scheduled visits based on different criteria. Factors to consider are health concerns, distance between visits, laboratory specimen collection, coordination with other healthcare professionals, and work within the physician's office hours. So which patients would you see first? Number 1, you're going to see patient C, as this patient has signs and symptoms that could place him in grave danger. The second patient is D, as this patient requires a lab sample and may be at greater risk if her blood pressure is elevated. The third patient you're going to see is A. This patient requires assessment of the leg for infection, but the other 2 patients were more serious. This person may have compartment syndrome, so think about that as well. And the last patient you can see is B, because even though this patient has dementia, there's no danger here as his medications are with you. So a little bit about home hospice care. Home hospice can provide relief of pain, symptoms, and emotional stress for the patient and family. The majority of palliative patients suffer from cancer, COPD, terminal heart conditions like CHF and valvular problems, and terminal neurological conditions like amyotrophic lateral sclerosis, or ALS, or multiple sclerosis like MS. Requirements are patients must have a life expectancy of 6 months or less, and the physician estimates this. Patient must not be undergoing or contemplating active treatment for their disease. and the patient must have decided to forego resuscitative measures at the time of death. Communication with the provider when the goal is not met is very important. You have to be a patient advocacy. And then palliative care is different. They relieve and prevent suffering in all disease stages, including curable, chronic, and end of life. So other things with home hospice care are spiritual needs, caregiver support, symptom management, and pain management. With occupational nursing, some general information defines the scope of practice and sets the standards of occupational health nursing. They devote much attention to keeping workers and, in some cases, their families healthy and free from illness and worksite injuries. Roles within occupational health are clinician, case manager, coordinator, manager, nurse practitioner, corporate director, health promotion specialist, educator, consultant, and researcher. They may be employed by a company or work as an independent contractor, or they might have their own business that provides occupational health and safety services to industries. Their work environment is to identify potential problems and determine the state of health of the workers. They might provide treatment or referral for medical or emergency care. They are there to improve healthcare coordination for early intervention and to help the employee return to work. And they know what resources are available for the employees, so they provide that information. They educate employees on different ways to improve the workplace. They do training for things like CPR and first aid education. They instruct patients on issues like accident prevention, ergonomics, smoking cessation strategies, and the importance of physical fitness. And they do research to identify the relationship between the worker and elements in the work environment that might positively or negatively affect their health. So let's talk just a little bit about epidemiology. So what is epidemiology? It's a basic science of population health, and it refers to the study of the distribution and determinants of health-related states or events in a specific population, and the application of this study to the control of health problems. It's based on the idea that disease, illness, and ill health are not randomly distributed in the population, but rather that each of us has certain characteristics that predispose up to or protect us against a variety of different diseases. There are several theories and models that describe disease causation and the properties that relate to disease processes and prevention. The epidemiology triangle is used most. This is the classic model. It depicts the interrelationship amongst the host and the environment. There's a change in any of the three aspects can result in disease. Prevention of the disease lies in preventing exposure to the agent, enhancing the physical attributes of the host to resist the disease, and minimizing any environmental factors that might contribute to the disease development. So an example is an exposure to a non-immunized adult, who is the host, to varicella, which is the agent. The virus at Walmart, which is the environment, would result in disease. So the agent is what? The agent is the cause of this disease. In most cases, the agent is a microbe, an organism that's too small to be seen with the naked eye. And disease-causing microbes are bacteria, virus, fungi, and protozoa. The host is the who. Hosts are organisms, usually humans or animals, which are expected to and harbor a disease. The host can be the organism that gets sick, as well as any animal carrier, including insects and worms, that may or may not get sick. And the environment is the where. The environment is the favorable surroundings and conditions external to the host that cause or allow the disease to be transmitted. Some diseases live best in dirty water. Others survive in human blood. Still others, like E. coli, thrive in warm temperatures but are killed by high heat. Other environmental factors include the season of the year. And then time is also included in this. It's the center of the triangle. Most infectious disease has an incubation period, the time between when the host is infected and when disease symptoms occur. Or time may describe the duration of the illness or the amount of time a person can be sick before death or recovery occurs. So many health problems have multiple causes. Simple solutions rarely exist. An example is a chronic disease like congestive arterial disease, cancer, and are not attributable to just 3 factors. Infection with HIV is an excellent illustration of this model. The clinically diagnosed causes of AIDS represent only a fraction of all cases of those people who are infected and have the potential to spread the disease. It's like the iceberg model. All you see is a little bit on top when there's that much more that's underneath the situation. So some epidemiological tools. The use of rates allows the nurse working in any setting to recognize when a health threat or disease encountered is normal or typical, or if a problem warrants further inquiry. So measure of morbidity is the state of being diseased or unhealthy. The incident rate is the number of new cases of an illness or injury that occur within a specified time. It's helpful in detecting and describing fluctuations in acute diseases. The prevalence rate is all of the existing cases of an illness at a given point in time. It's helpful in measuring chronic disease. The measure of mortality is the number of people who have died within the population. And it includes infant mortality rate, crude death rate, and cause-specific death. So infant mortality rate is the number of deaths under 1 year of age during a given time. Crude death rate is the total number of deaths reported during a given time. And cause-specific death is the number of deaths assigned to a specific cause during a given time. So sources of population-focused data for nurses in community-based practice include the census and local, state, and national vital statistics and health statistics. The census is conducted every 10 years. There are specific tracks that allow for analysis of smaller units within a community. Vital statistics are data collected about significant events that occur within a population over a period. It includes data from ongoing recordings on vital events such as births, adoptions, deaths, marriages, and so forth. And health statistics, the CDC, National Institutes of Health, are primary sources for morbidity and mortality data in the United States. Wisconsin has 3 categories for reporting communicable diseases. The Category 1 must be reported immediately to the state of Wisconsin. Examples are foodborne or waterborne outbreaks, measles, pertussis, rabies, and TB. Category 2 must be reported to the state of Wisconsin within 72 hours. Examples are blastomycosis, chlamydia, gonorrhea, syphilis, pelvic inflammatory disease, ehrlichiosis, anaplasmosis, Lyme disease, hepatitis B, C, and D, and varicella. Category 3 are reported to the state epidemiologist on an AIDS case report within 72 hours. Examples are AIDS and HIV. So vaccinations against communicable diseases have dramatically affected morbidity and mortality. Active immunity is protection produced by the person's own immune system. It's long-lasting and often occurs after a person has a disease or through administration of a vaccine. Passive immunity is protection produced after transmission from another person. It's short-lasting, usually only weeks to months. An example of this is from mother to fetus. Immunization schedules, you should know about those, the routine child immunizations, and then those for adults like influenza, varicella, and a whole host of others. And then make sure you know about contraindications. They do occur due to allergies to eggs, egg proteins, antibiotics, and preservatives. There might be mild illness with or without a low-grade fever. That's not contraindicated for vaccination. Pregnancy is not contraindicated for immunization. Using inactivated vaccinations, antitoxins, or immunoglobulins, and pregnant women and immunocompromised patients should not receive live vaccinations. So that's the end of the community lecture. I hope that you learned something.